How does an MRI magnet strength matter?
20 years ago, the open magnets came out as pretty much the standalone, personally owned MRI imaging because the high fields were in the hospital. Recent years, though, we've now have high field magnets that are in, imaging centers throughout the area. The open magnet, though, does gives us a contrast exam, which in most of the times is okay. The clarity, though, from the high field allows us to look at things a little more in depth, thinner slices, quicker exams, better evaluation of certain mental complaints, spinal injuries. Now, when we talk about high field, a lot of people will talk to you and say, oh, well, that's why we have to have a 3T. I think if you talk to most radiologists, 3T is a great addition for the brain, but the high field magnets are really the workhorse for musculoskeletal and spinal imaging. The exams are clear, long as the exam and the machine is kept up to industry standards, you end up with great images. And if you have a patient that is claustrophobic, there are open high field imaging centers that have high field open centers and open machines that can help you with that claustrophobic patient. We don't really, in today's society, I don't really feel that we need to use a lot of the opens unless a patient's severely claustrophobic. And many times, if they're that claustrophobic, they give them some, your doctor can prescribe some Valium or whatever needed to anti-anxiety and calm them down and let them get through the examination.
Got it. And then what are some possible signs of acute disc injury on MRI?
Well, that has been a ever never answered question on in radiology forums for the last since MRI has been. I mean, we can look for inflammatory change, soft tissue swelling within the discal changes. There are changes that we will find maybe annular tearing that we can trace back to the nucleus, and we can say, that looks relatively recent as far as chronology and able to exact age of the injury. It's very difficult, but we have examples that we can take the examination and say, well, this is what it was 14 days after the accident, and here's what it is a month and a half after the accident. And you can see a difference in the signal intensity of the nucleus as well as the annular fibers of the disc. That's why I always think that if needed, if clinically indicated, the sooner we get the imaging, the MRI imaging, the better we're going to demonstrate, is this something acute or is this something that's just been there? And just because it's been there, it doesn't mean that it's not an important factor in the patient's care, because it can predispose them to further diagnostic things that are going to be needed, further therapies down the road, because it may take a little bit longer for them to get back to normal.
And then finally, can you name 5 reasons why flexion extension x-rays matter for soft tissue injuries?
One is the demonstration, really one of the only, how do I put this? The only objective way to really demonstrate soft tissue, i.e. ligamentous and or capsular ligamentous injury, is via flexion extension x-rays with CRMA analysis, which is computer radiographic mensuration analysis, which is necessary to come up with objective findings of injury. That's the primary one. Two, if you just take some people don't even want to take x-rays. X-rays are necessary in any personal injury case. What we're doing really is evaluating for bone injury, but majority of the cases that come through with injuries are not fractures, they're not dislocations, they're soft tissue. And we find that many times we either overtreat or undertreat because we don't have a distinct diagnosis of injury that we can say this patient is injured. Here is the area that they're injured at. This is what we want to do. This is why we want to do it, because we're like back in the 1990s before MRI was really big and before the use of cell phones and laptops and tablets, people would say, oh, the curve is reversed on this patient. That's soft tissue muscle spasm or soft tissue injury. But we couldn't really definitively prove that there was soft tissue injury. we were just assuming. Now, with the flexion extensions and the computer enhancement, digitization or computer enhancement of the x rays, we are then able to say, this is where the injury is, this is where the injury is, this is most likely caused from the accident. And it gives the doctor the chance for proper therapy, proper referral. It gives the attorney probable cause for to know that there's an injury and what is going to entail this person down the road.
Is there any other reasons why you think it would be important for those flexion extension X-rays?
Well, I mean, really, they're a value driver for these cases. I mean, there's many doctors out there that they go, "Well, I got 30 cents on a dollar." Well, yeah, because you didn't prove anything. We need to prove that there's objective findings, both for the prognostic evaluation of the patient and the monetary evaluation of the patient from an injury or a car accident or anything else. So those are pretty much the basic ways. I know the 5 reasons. I don't know if we could come up with 5. The first one is the ultimate that, we wanna make sure that that the patient is best taken care of in a way that if we need to send them for a proper referral, that can be done in an expedient way. If they're having pain, do we want to adjust people to chiropractors? Do we want to send them and have them adjusted with ligamentous injury? I don't think so. I don't think that's wise for the patient. And when we ask for more therapies or we try to get more therapies, we have to have a reason why, not because the patient doesn't feel well. Subjective findings are all these, as we say, subjective, and that makes the case managers and adjusters subjectively allowing that and subjectively allowing what they're going to pay. You have to have objective evidence. There's some people that may not agree with that, but I think we have to proceed and keep up with what is available as far as diagnostic evaluation of personal injury case or any kind of patient. 20 years ago, we didn't really have this flexion extensions and computer enhancement and everything else. So we were sort of stuck with what we had, doing lines and everything else on the patient's x-rays, but they're not as specific and they're not as re-demonstrated that we can show that these are the best ways and there is definitely injury and we move from there.